Thank you for joining us for today's Grand Challenges Power Hour. Here is Dr. Charles Clancy to kick off our event.
Hello, good afternoon, and thank you for joining us this afternoon for our, July edition of MITRE's Grand Challenge Power Hour. My name is Charles Clancy. I'm the MITRE Labs Senior Vice President and General Manager, and also serve as MITRE's Chief Futurist. For the past year, MITRE Labs and MITRE Center for Data-Driven Policy have been hosting these events, really focused at the intersection of science and technology and where we see science and technology headed and policy, really with a goal of driving the conversation forward around where we should be looking at this really interesting intersection. Certainly, as we see an administration and a Congress that is where investment in science and technology is really a bipartisan issue with a lot of support. So today we will be focused on MITRE's work to really develop and promote a national strategy for digital health. Digital health is something that was, I think, really more visible in the world of COVID-19, where we had to move quickly and we needed the tools to interconnect clinicians with researchers, with public health infrastructure, and the digital plumbing that underpins our health ecosystem became increasingly important. So sort of as part of that and as a result of that, MITRE and our Health Advisory Committee developed a call to action, a national strategy for digital health. And we're going to be putting a link to that, I believe, in the chat for folks to check out and peruse. You can also contact our digital health team at digitalhealth@mitre.org, provide feedback or follow up or interested in discussing any of the ideas therein. Also, I want to remind everyone that this event is public and open to the press and will also be recorded. Once we kind of get through the editorial process, we'll be posting this to MITRE's YouTube channel. And also that MITRE is hiring. We've got a wide range of roles open, from science and technology to clinical roles to data and sort of everything in between. So if you're interested in many of the topics we discussed today, please feel free to reach out to recruitinghelp@mitre.org or look online. We have certainly vacancies posted. So with that, I'd like to hand the mic over to Dr. Sybil Russell. Sybil is one of our sort of innovation leads here at MITRE. She oversees our internal research and development program in healthcare as part of our Healthcare Innovation Center. She's also a practicing clinician and pediatrician, which I think brings some really unique insights, her clinical experience, into informing the research that we do here at MITRE. And so with that, let me pass it over to Sybil, and I will for you to kick off the first segment.
Great. Thank you, Charles. Thank you very much. Good afternoon. I am grateful for the opportunity to moderate today's fireside chat with two very distinguished guests, Drs. Woodson and Dr. Noseworthy, on a very important topic, digital health. Specifically, I hope today we can learn about their insights into MITRE's draft National Digital Health Strategy. For this discussion, Dr. Noseworthy will be joining us through audio only, primarily due to technical issues. And so I just wanted to give a special thanks to Dr. Noseworthy and to the MITRE technical team for finding a way to make this happen. For our session today, I'll begin with brief introductions and provide some context. And then we'll share a 20-minute chat with our guests, followed by 10 minutes of question and answers from the audience. For our audience participants, please feel free to post your comments and questions in the chat box. And the exciting thing is this new platform allows us to have the audience participate in not only adding their comments and questions, but also to engage with one another through this. And we hope that you will engage with us through this mechanism. So let's get started. It's my pleasure to introduce Dr. Jonathan Woodson first. Dr. Woodson is the director of the Institute for Health System Innovation and Policy at Boston University. In addition, he serves as a Major General in the U.S. Army Reserve Medical Command. Dr. Woodson is the former Assistant Secretary of Defense for Health Affairs. He also serves on MITRE's Health Advisory Committee. Thank you for joining us today, Dr. Woodson, and thank you for your service. I also have the pleasure to introduce Dr. John Noseworthy. Dr. Noseworthy is President and Chief Executive Officer Emeritus of Mayo Clinic. He is also a Professor of Neurology Emeritus of Mayo Clinic. In addition, he was the former Editor-in-Chief of Neurology, which is the official journal of the American Academy of Neurology. Currently, MITRE is fortunate to have Dr. Noseworthy serve on the MITRE Board of Directors. Thank you for joining us today and your service as well, Dr. Noseworthy.
Thanks, Sybil.
Yes. So today marks a special day. It's the beginning of what we hope will grow into a robust conversation and discussion on digital health. Specifically for our chat today, we're going to focus on MITRE's draft National Digital Health Strategy. We hope that many people from the federal government, industry, academia, and communities will engage with us and share their insights and experience that will help us to inform the strategy as it grows. I'd like to start with Dr. Noseworthy. Dr. Noseworthy, why do you think it's important for our nation to have a strategy on digital health?
Well, thanks for this opportunity to join the conversation, Sybil. And yes, I'm honored to be a member of the Board of Directors of MITRE. As we all know, MITRE's purpose is to create solutions for a safer world. And it seems clear that coming together on a national strategy for digital health is timely. This would strengthen our nation and help guide other nations to advance global health and global safety. So it's very important. But make no mistake, this will be a huge and complex task. Why do I say that? Well, first of all, our health and healthcare system must become a national priority if we're to create a sustainable, high-quality system that focuses both on health and disease prevention, as well as innovative science-driven solutions to illness. Secondly, the time seems right now to realize the promise of a scalable digital solution to refocus and strengthen our healthcare system. And finally, can you still hear me? I'm sorry, something's happened here.
Yes.
You can still hear me. I'll continue. I'm sorry. Finally, a detailed strategy, as you mentioned, will avoid simply layering digital technology to our current healthcare system, and that would fail to address the complex inequities that are currently in place. Let me elaborate a bit, Sybil. First of all, in my opinion, we don't have an optimal system to look after the nation's health and healthcare. Our so-called healthcare system doesn't really function as a system. It's huge and complex and approximates a fifth of the US economy. It's fragmented and expensive. In a study released this week by the Commonwealth Fund, access for many is severely limited and has been for a long time. Healthcare quality is uneven in the country, and these inequities primarily impact the disadvantaged. Our public health service is not well supported, with only limited investments in advancing health and prevention. Secondly, it seems that we are at an inflection point, as demonstrated by the pandemic. We can clearly see now the promise of digital solutions, including telemedicine. Now, leading major change such as this in any sector, as we all know, is extremely difficult. But good news, healthcare professionals have now embraced digital solutions that before COVID, they resisted, or at best, they only half-heartedly used. The barriers of cross-state licensure and other regulatory and billing practices have been temporarily relaxed during the pandemic, and that's been helpful. The private sector, as you know, is creating competitive solutions in this space. And the pandemic has clearly demonstrated and reminds us, unfortunately, that healthcare inequities in our nation are serious and must be addressed. The disadvantaged, including the poor and people of color, have suffered disproportionately by this pandemic. Digital health solutions, many of which are clearly scalable, can go a long way to begin to address this need. Thirdly, a clear and comprehensive strategy is needed, given the size and complexity of healthcare. The barriers are significant, but an informed, intentional approach that prioritizes the solutions, addresses the barriers, sequences the steps, and assigns resources and accountability will be needed to bring us forward. As we will discuss, the draft National Digital Health Strategy is, in my opinion, very well done. Additional input is needed from industry, from the profession, and from the community, particularly the communities impacted negatively by the social and political determinants of health.
Dr. Noseworthy, thank you. Those are some very important points. I'm particularly interested to learn a little bit more about the barriers you mentioned. Could you please share a few examples of the important barriers that you think are inhibiting us from realizing the potential of digital health to address some of the challenges you shared?
Thanks, Sybil. Yeah, I'd name two broad categories of barriers for starters. The first is cultural, and the second is largely technical. But the cultural barrier relates to folks taking up these tools and using them. There must be a commitment to create and broadly adopt scalable, first consumer-friendly, and hence patient-friendly, and also provider-friendly digital health solutions, as both the providers and the patients and their families must embrace these solutions. And as I mentioned, we've made some good progress during this awful year and a half of the pandemic. Yes. Secondly, the many issues surrounding national healthcare data are critically important and will be discussed in greater detail throughout the program, especially later in the program. But these include some thorny topics. Data governance. So who owns healthcare data and who can access it? Data privacy. The longstanding need for a national patient identifier. Terminology standards for all data. Interoperability across systems. Targeted healthcare outcomes and metrics, and of course, nationwide access to broadband. Those would be a few, and they sound easy if you say them fast, but they're not.
Yes, those are definitely some very big barriers. Thank you very much for sharing your insight. And in addition to the barriers, I wonder if, Dr. Woodson, I'd like to ask you a question about other potential impacts that could happen as we transition to a digital ecosystem. Dr. Woodson, how do you recommend that we ensure that the development of a digital health ecosystem does not widen the digital divide and it does not increase the inequities that we already have in access to care and poor health outcomes for disadvantaged populations?
Well, that's a great and important question, and thank you for including me in this conversation. As Dr. Noseworthy said, this is a timely subject and an important topic for our nation to address. And the first issue is, in terms of answering the question, is to first ensure that there's a strategy. And we should return to the primary definition of a strategy, which is a plan of action or policy designed to achieve a major or overall aim. It really is about focusing efforts and goals, designing the future because it is future-oriented, synchronized activities, and providing the resources. In regards to making sure that we don't increase the digital divide, that means ensuring that in this strategy we're addressing the issue of health equity and those barriers to access to digital technologies that are going to occur without a strategy. So one of the things that I think we need to understand is that digital health is already here, but it's unevenly distributed. Without a strategy, it's likely that this digital divide will worsen as those individuals who don't have access, perhaps because of lack of economic ability to obtain technology, or if they live in rural areas, will suffer under this growing divide without a strategy that consciously addresses what their needs are, what the needs of these communities and these underrepresented segments of our population are. We need to ensure that the strategy ensures that there's equity and inclusivity in design. And this means that as we develop technologies, we have community-based processes that give insight to technology developers in terms of making sure that the technologies that are developed are, in fact, user-friendly. In our own institute, we've had researchers who developed conversational agents that were culturally appropriate and have demonstrated in randomized studies the effectiveness of engaging and activating patients and developing health literacy, particularly around maternal health issues. We need to define the broadband needs of communities that are underrepresented and in rural areas. And we need to ensure that we create really a culture of respect, responsibility, and accountability that drives the development of digital health. So if you think about it, back in 2001, the Institute of Medicine, now the National Academy of Medicine, defined several pillars of the optimal health system. They talked about it being safe, it being effective, it being efficient, it being patient-centered, and now we should redefine that term in terms of precise, it being equitable, high-performing or learning, and connected. All of these pillars need to be redefined in terms of a national digital health strategy. And we need to look at the models, the processes and policies that need to support digital health, the development of these digital technologies, and give guideposts to that. We need to understand what strategic capabilities we really want from digital technologies. And as Dr. Noseworthy said, address the culture. And if we do that, I think we can ensure that the digital health strategies does not increase the digital divide.
Wow, thank you very much, Dr. Woodson, for sharing those insights. I wonder if we have time for one other quick question before we move to the audience participants' questions. And so I was hoping to ask this question first of Dr. Woodson and then of Dr. Noseworthy. So keeping all of the points that we've just talked about today in mind, I'm wondering, do you have recommendations with whom and how we can best engage with stakeholders and communities on this digital health strategy and the transformation to a digital health ecosystem?
Yeah, great question. And so with intent, we need to make sure that the process is inclusive, that we bring the appropriate stakeholders in, not only government and academia and industry, but communities, and make those proper assessments of what their needs and what the barriers are for using digital health. We may have to be innovative in thinking about creating sites where individuals who might not have the technology themselves or be limited in their ability to use the technology can go, that is easy and close to be able to use, let's say, a digital health room that could be based at, let's say, a retail platform. We have many CVS and Walgreens around that have urgent care centers, but create perhaps these digital health rooms that people can go and receive care. This might be very important in rural areas if individuals do not possess personally digital technologies. But that's just an example of thinking differently and thinking out of the box. But the real issue is to ensure that we have inclusive development of the technologies, ensure that we have stakeholders who give feedback on how we develop the system and what we're thinking about in terms of developing the system. And most importantly, I think, as Dr. Noseworthy discussed, is creating a system of governance that ensures that over time we have the inclusivity that ensures that everyone's represented, everyone's interests are represented as we go forward.
Yes, thank you, Dr. Woodson. I really appreciate those thoughts. And Dr. Noseworthy, could you share what your thoughts are about with whom and how we could best engage with stakeholders and communities on this important topic?
Sure, Sybil. Well, Jonathan covered that very well. Maybe just make a couple of points to build on his comments. The MITRE COVID-19 Coalition was a wonderful example of how MITRE can serve as a trusted convener in both the public and private sector. And I suspect some of our listeners or watchers today, observers, participated in that COVID-19 coalition. And if you did, congratulations and thank you for doing that. But MITRE was able to bring together hundreds of stakeholders and produce actionable outcomes in just a few weeks. And of course, that, as Dr. Woodson mentioned, that's great for industry, for academia, for non-traditional healthcare data and technology companies, big pharma, device companies, et cetera, et cetera. But the other point we need to do is really remember, what is that comprehensive list of stakeholders? And I would put at the center that patients and their families. And some patients are advantaged and some are disadvantaged, but we do need to hear from the patients from both of those groups. And as Jonathan said, it's academic healthcare, but it's also community healthcare and public health workers and so on. And then really get into the communities. And as we talked about a couple of weeks ago, this is an area that MITRE will need to be very creative. And Jonathan gave some great examples of how to do that. MITRE's done a magnificent job, and it works extremely well with the haves, if you will, industry and academia and others. But we'll need to get better at getting right to the place where this happens in the communities, especially rural and inner city communities that are struggling. If we're going to address the social determinants of health, but also those political determinants of health. How did this happen? How did we end up with such an unequal system? And how do we go upstream to that and change the political and structural issues that are getting some attention in this country? And that'll involve bringing in leaders from the private sector and government leaders in affordable housing, education, food security, transportation, and law enforcement, to name a few, as inequities in each of those profoundly impact the health of our communities.
Yes, they do. I completely agree with you. The inequities are serious, and I'm hopeful that we can start to make a difference. Thank you both for a fantastic discussion. And now it's time for us to turn to the audience participants to see if they have any questions. I'm going to get the questions for you. Okay, so one of our participants is asking, and I'll start with you, Dr. Woodson, if possible. What type of policy or interventions do you think that digital health strategy could include that would make or help enable patient data ownership real?
Well, great question, and I think that's at the center of the strategy. It's about empowering patients to take charge of their health management, be able to control their data, be able to interact with healthcare providers more effectively through digital technologies. Remember, every industry in our society is grappling with how they're going to do business in the digital age, and healthcare is no different. It has been sort of acutely pointed out to us, sort of the inequities and how far we need to go. And through the COVID crisis, we've had health systems that on the fly have adopted digital technologies to stay in contact with their patients. But that really represents the floor. And the promise of where we can go with the strategy, I think, is really tremendous. And be able to focus on customer or patient-centered needs, to be able to organize through platforms information that the individual needs to make good health-related decisions, provide them with sound, verifiable information that can help them in the decisions and their interactions with the healthcare providers going forward. So I think the real issue is that the digital strategy will support the individual empowerment, engagement, and activation in a real way.
I agree. The person did not include this, but I wonder, building upon what you just said, I'm curious if you have thoughts about how we can move the needle when it comes to health literacy and digital health literacy, because many individuals have challenging times. I think of this all the time when I'm trying to use my computer for all these Zoom meetings that we all had to do during the pandemic. And so when you're relying on technology for your healthcare, it will likely be very important to provide tools for individuals to have a meaningful interaction with their providers. I wonder. Yeah,
no, so good question. And again, this is why I think we need to involve real people in technology design so that it's user friendly. But the truth of the matter is that today, as we sit here and discuss this topic today, large segments of our population are using digital technologies to organize information, seek out information, to improve the way they live, work, and play. And yet healthcare is far behind. And what we need to do is develop those user-friendly platforms that have verifiable information, because there's a lot of misinformation out there in social media and the like, but verifiable platforms that individuals can go to that might be automated as well, use artificial intelligence to help guide customers and patients through a decision-making process or through a fact-finding process on a specific healthcare-related problem that they are facing. So I think the issue is that if we do it right, we have an enormous opportunity to promote and build greater health literacy through a digital strategy.
Yes. Dr. Noseworthy, did you have anything to add to that?
Well, talk about thorny issues. I mean, who owns the data and how do you access it, and what do actionable items look like from health data? So one could be overwhelmed by how complex and political and this all is. I guess I'd take the optimistic view that it's easy for all of us to see the potential of the future to make people's lives better. And I think as long as we keep that in the foreground, smart people will figure this out. But it has to be a priority. Without that, if patients can't have actionable data that will help them with their decisions, we've failed. And so that has to be one of the holy grails. And my hope is that smart people will come together and say, yes, this is important, and here's how we make it work. I mean, the issues of a national patient identifier, you go to certain European countries and you register and you have your identifier. It's all taken care of. We've been talking about that for decades. So we have to get to some pragmatic solutions quickly. And I think we will know this when patients are able to make important decisions. And until that's the case on their own data, we've got a long way to go. But this is probably the toughest issue, or one of them.
Yes, I agree. And as a practicing physician, the workforce, I'm hoping that the technology will also help start to reduce some of the burden on the especially after the pandemic. A lot of clinicians have really had challenging times, and so I'm hopeful also that the technology, as we develop it, and if it's user friendly, and it will hopefully make things a lot better when we're at the patient's bedside, and I guess now the bedside is not always in person; it's virtual too. So it's a different world now, and so the future. I wonder if you have thoughts about training our future clinicians and people going into to healthcare and
Sure.
and public health.
Yeah. So that's an extraordinarily important issue that, as part of a strategy. Remember, again, the strategy is all about outlining the spectrum of issues that need to be considered to get to where we want to be in terms of that vision of the future. It doesn't mean that we have all of the answers today, but if we don't consider the entire spectrum, we're not likely to get to where we want to be. One of those issues is the workforce, and how we develop our professional workforce to work in a digital age. So how are they positioned to use digital tools to serve the needs of patients and customers better, to serve the needs of communities better, to drive better public health systems? That clearly is an objective. And in order to achieve that objective, we've got to develop the workforce differently.
Yes.
I guess the other point I'd make, Sybil, just on that one, is going back to the culture. We have to make the lives of the professionals in healthcare better, using technology to make them better. And we failed on that promise. The whole electronic health record story that you touched on is one example. decision support tools that would make their life better. Instead, it just filled their inbox with alarms and notices and so on. And we really have to make that work. Otherwise, if we lose the providers, we lose the caregivers through burnout, this will slow down and we'll go backwards. So that's why I said they're cultural, and we have to make those changes in a way that are good for providers and also technical. So lots to do, but I'm sure we can get there.
Yes, I'm hopeful we can get there, and I'm just very grateful for the opportunity to chat with you both today. I actually don't think that we have any other questions. We are, I think, a few minutes early. So I will actually would like to put in a plug to wrap up this section. I just wanted to say a sincere thank you to Dr. Noseworthy, to Dr. Woodson for your time and sharing your insights and your thoughts. I'd also like to highlight for the audience participants that we hope that you'll reach out to us. This is just the beginning of this discussion. We're looking forward to learning more about your experience and thoughts on the transformation to a digital ecosystem and how we can do it better. One way to do that is if you reach out through the digitalhealth@mitre.org, and you can provide feedback, you could schedule a discussion, and we would be delighted to engage with you.